Hello, Dr. Keith Smith with you, Surgery Center of Oklahoma. Thank you for following this blog and video blog series. Stephen Brill, author of the Bitter Pill story that was the sensation of Time magazine, has had heart surgery, and now all the high-priced millionaire administrators in their overpriced hospitals he's so savaged in that article, he's fallen in love with. Maybe it is an example of Stockholm Syndrome, but he wants to turn the whole healthcare system over to them, even embracing the latest idea, which is actually an old idea, of hospitals owning insurance companies. The hospitals would say that, well, this holds us accountable for better outcomes. Actually, what it does is the same thing HMOs do, except worse. I'll explain in a minute. What it does is it incentivizes the hospitals to deny people more expensive cares and remedies that they might require. Hospitals owning insurance companies are worse than HMOs because in the old days you would hear all the stories about the doctors that were fighting the HMO, even though the doctors were part of the HMO and made more money to the extent that patients were denied care. You would hear the stories about the doctors fighting the HMOs who would not allow patients to receive the treatments or remedies they required. If a hospital owns the insurance company, who do you think the hospital is going to include in their insurance network? Well, it's going to be the doctors that they employ. The doctors completely under their control. This is HMO denial of care on steroids. It's actually been seen in the past. It's an old idea. But the idea that this is a good idea now, even when it was demonstrably a bad idea in the past, it doesn't make any sense. We don't need laws to prevent this thing. We don't need the regulatory oversight that government brings. All that does is preserve the scaffolding that allows for the paybacks and the bribery, all the while veiling, the real mission of this type of activity. What we need is buyer beware. We need for everybody to be aware of this so that if they buy an insurance product that a hospital is selling, that they know what they're buying. We don't need more laws. We need fewer laws. I've always thought that if we have a new law, we should have an old law go away, or two laws go away, and maybe things would get better over time. Buyer beware. I think it's important to understand why hospital-owned insurance is a really, really bad idea if, after all, our goal is to provide affordable, high-quality care and preserve patients' choice. Thanks for joining us. We'll see you next time.